Welcome to Rowe Dental Laboratories GuidedSMILE surgical tutorial. This video will take you through the steps to complete a GuidedSMILE case. There are options with GuidedSMILE. Most cases involve the four-step process that you see here with the green circles. There are alternatives. If there is no bone reduction needed, or you do not want your drills controlled, you want to do a freehand GuidedSMILE, that is also available. But this video will take you through the full process of the 4-guide system. And then we will briefly discuss the rapid appliance and the final restoration. So GuidedSMILE is a 4-guide process as a standard, with an option for a full package to include the final restoration and our rapid appliance, which makes the transition from the PMMA conversion to the final restoration very simple and reduces a number of appointments. It's important to take some preoperative steps. So once you receive the case from us for surgery, take the contents out of the box and even the guides out of the bags and the bone models and the pins, and practice inserting the pins into the proper guides. Notice how the pin guide fits to the model. Also notice how the pins fit in through the guides into each of the models. Study how the bone looks on the bone reduction model before and after. Rub your fingers across the guide, feel the transition from the guide to the bone. And then lastly, pin the PMMA prosthesis and notice how the holes on the PMA line up with the bone. This is important to study this prior to surgery so that there are no surprises. It's also important to make sure that all the components are available and have been ordered. Make sure that there are adequate number of pins, that there's a drill. Ensure that the proper implants have been ordered and are on hand, that the multi-unit abutments are the right cuff height and angle, that there are extra abutments just in case things have to change during surgery. Make sure you have the temporary cylinders or even double temporary cylinders if you're going to perform the rapid appliance. Make sure you have comfort caps, and then acrylic and blockout material. All of these elements are essential for a surgery to go smoothly. So the first step is the pin guide, and the pin guide is what sets the pins for the remainder for the subsequent guides. As long as the pin guide is seated accurately, fully and accurately, then the subsequent guides will also fit the same way. So the first step is to practice with the guide in the mouth. Make sure that it fully seats without a flap and that you can see the teeth through the windows. There'll always be buccal windows on dentate cases. If the patient is edentulous, then the pin guide rests on tissue, and when it's inserted, you can practice and have the patient gently close and bite into occlusion. If needed, use cotton rolls. Have the patient hold firm during this checking phase, and then you also want the patient to bite down while you're making the buccal pin holes. Patients may be asleep, therefore holding it manually with the assistant and with the surgeon's hands, holding it firm in place while the buccal holes are drilled. You can watch this video to see how the appliance is held in place while the buccal holes are drilled for the fixation pins. Generally, a flap is not performed until the pins are set. So the guide is fully seated, and the drill, the BioHorizon drill that comes in the kit, is used to go directly through the tissue into the bone and fully seated. During the guide plan meeting, you'll notice that that drill, if possible, will go all the way through the bone and actually engage the lingual cortex bone. The anchor pins and the drill are both transcortical. You'll notice through the pin setting stage that once the holes are drilled and that they're all drilled, the pins are inserted, and quite often the pins are very tight, fitting into the bone, and a surgical mallet is frequently used to make sure that they are fully seated. It's also important to note that all of the guides, including the pin guide, float above the bone and even above the tissue on the pin guide, so that the only anchorage on the pin guide is the teeth or the tissue on the ridge or even the palate. The anchor points, the fixation areas where the buccal sleeves are placed, is away from the bone or tissue. It floats. And so that the only point of anchorage on the subsequent guides is the pins. The pins are the only thing that hold the guides in place. So you can watch these two videos and just see the sequencing of placing these buccal sites for the pins. So once the pin guide has been anchored and ensured of the that it's fully seated, it is removed, and then a flap is laid and extractions are performed if it's a dentate case. The next step will be bone reduction. We offer 3 different types of bone reduction. The first is a standard full wrap. This has been available for a number of years through our surgical guides. This does require a large flap, lingually and posteriorly. However, it is the most accurate way of performing the bone reduction as far as a buccal lingual goes, because then you have a strap along the buccal, strap along the lingual, and you really connect the two planes to make an even plane of bone reduction. Number 2 is a labial guide. This guide is preferred when a flap is going to be really too large and too unmanageable. So this will only anchor in the labial, and then you will perform your bone reduction, and you'll have to eyeball the plane as far as the buccal lingual goes. But bone reduction will still be completed in the same manner, whether you're using a piezo or a burr or a surgical saw. Both are an option for those 2 guides. The third option is GuidedSMILE FH, and we can discuss this more in a one-to-one conversation. But the essence of this guide is for doctors who do not want an osteotomy guide. They don't want their drills managed. They want to take more of a traditional all-on-4 type approach. It's a wonderful guide, but it's really a kind of a side conversation to understand its use. Once the surgical guide, the reduction guide, has been inserted and the pins have been tapped in with a mallet if necessary, then the bone reduction is completed. You'll notice on these images that there's quite a bit of bone reduction. If the bone reduction is minimal, then during the planning meeting you can opt out of the bone reduction guide and just use a burr to flatten a ridge or just remove a small amount of bone, and you can skip this process. Most GuidedSMILE cases that we work with do require a bone reduction guide. You'll also notice in the pictures on the left and the right that the pins, the plastic around the pins that hold them in place, are above the plane of bone reduction. This is quite common when there's going to be minimal bone reduction, or we want to keep the pins down, less apical but more down towards the ridges. So in these cases, you'll reduce the bone in the windows where you can see the bone, and then the guide can be removed, and then you can see the image in the middle where the bone has actually been reduced down below those tubes, down below the tube windows. Once this is completed and the ridge is flat, then this guide can be removed. We do show videos of how to anchor the guide, and also a video that shows a piezo being used in bone reduction with the guide seated. So please watch these videos in the PowerPoint also on this web page. The third guide is the osteotomy guide. This is pinned just like the other guides, same holes. And then once seated, you'll use your fully guided kit and then follow the drill management steps as indicated for each system. Each case comes with a drill report that identifies the implant size with the site and which tool to use from your guided kit in order to complete the case. The implant protocols and sequencing are very standard for the implant company. Please follow the instructions again from the implant manufacturer. It's also helpful to have a rep chairside who is very familiar with the system if you have not used your guided kit very often or first time. The fully guided kits usually are available from the implant company. If not, if you're using a universal kit, then of course follow those protocols. The master tubes on the guides should allow you to place the implants, torque them to the right direction, which we'll cover in just a minute. Rotation, we'll cover in just a minute. Again, there are videos on the web page on the PowerPoint that you can observe that show surgical drilling and, of course, again, repeating with the mallet to make sure that the surgical guide is fully pinned, fully anchored on every guide. It's important to note that on our GuidedSMILE guides, the osteotomy guide, that the notch on the guide is oriented to indicate where the implant's rotation should stop. And that can be completed with the handpiece or can be completed with a torque wrench. Again, a video will demonstrate the process. Once the implants are in, the guide can either be removed to place the abutments, or you can place them through the guide. It'll be the practitioner's choice. The bottom left of the screen shows the abutment positioner guide. This is by request, but we can print a resin, basically a resin bone model that has the abutments and screws aiming in the right direction. Please request this if you'd like to see it. You can also have your directions given to you just through our GSI report, which comes with every case, and it'll indicate through an image. There'll be an image in the report that shows you the direction of the abutments and where to stop the implant rotation. When the abutments are torqued and the temporary cylinders are in place, test the carrier guide and the prosthetic to make sure that the temporary cylinders will emerge through the middle or somewhere near the middle of the holes in the PMMA. It's very important that the angles of the temporary cylinders project through the guide, that they don't contact the side of the tubes that have already been pre-planned. If the temporary cylinders come into contact with the side of the guide or inhibit the guide's seating, then the guide should be removed, and the particular temporary cylinder and abutment should be adjusted so that the correct trajectory of the temporary cylinder corresponds with the hole, the shaft, in the PMMA. This is a very vital step, so take time to make sure that everything is adjusted according to the proper trajectory. Use the GSI report for abutment rotation, or the model that we provided, or eyeballing. You'll notice in these images on the screen, the left two are two-piece guides. This means there's a carrier, and there's also the PMMA, the aesthetic provisional, that is resting on top of it. It's a male and female connection, but they simply attach and are held together while the carrier guide is anchored in the mouth. The prosthesis to the right is a one-piece guide. We fabricate this when there's not enough vertical space to have materials for a two-piece guide. You will know that that one or the other has been manufactured prior to surgery based on the plan. So the first step is to seat the carrier tray, the image on the left. Fully seat the pins. You'll notice in the image that those pins are not fully seated. It's very important that they're fully seated and malleted into place. The middle image shows the blue blockout. This ensures that the acrylic that is flowed around the cylinders in step 3, image 3, does not go down into the area around the temporary cylinder in the carrier. You don't want the PMMA being locked in the mouth. Now you can always unscrew the temporary cylinders and the entire prosthesis will come out along with the carrier, but the idea is that only the PMMA and the temporary cylinders come out at this point. You want to leave the carrier in, especially if you're going to complete the rapid appliance, which we'll show you on the next screen. It's also important that the inside of the tubes, the voids where the temporary cylinders are, that you prepare the inside of the PMMA with an adhesive so that your acrylic or that your Voco pickup material will adhere to the PMMA. Once the PMMA has been removed and taken back into the lab and finished and processed so they can be returned to the patient for the temporary, you leave the carrier in the mouth and you perform your second pickup. Now please remember, this second pickup, which is called the rapid appliance, is only available if you've purchased the entire package, which is the GuidedSMILE and the final restoration. In order to perform the second pickup, an extra set of temporary cylinders would have been ordered. These are inserted at this point, hand tightened, and then a second clear PMMA type prosthetic is inserted. It'll be a clear appearing appliance made with resin that you will simply complete a second pickup using the same Voco material or acrylic pickup material. This appliance will be either returned to the lab or held until the patient is ready for the final conversion, and it'll be used as a pickup. We can talk in more detail about that over the phone in a conversation. But the rapid appliance will minimize the restorative process by a number of appointments by providing a model and the new tissue heights. This image is going to shows the one-piece surgery. There's a video online. The one piece, again, is provided when there is not enough vertical clearance for a two-piece system. In this system, you can also have a rapid appliance, a second one made for the pickup. This particular one piece is tacked in, anchored, and use acrylic in the same fashion explained before with the two-piece, and picked up and turned into a temporary prosthesis. During the conversion and the finishing of the prosthesis, comfort caps may be inserted if needed, and the patient is sutured, and the patient waits while the PMMA is converted for final insertion. With the PMMA in the laboratory on site, the temporary cylinders are disked off so that they do not protrude above the acrylic. It's important that no acrylic flows down inside of the temporary cylinders. That will inhibit the ability to put tools inside the cylinder. And it's very important that all areas of the temporary are filled with acrylic and are polished and are smooth, and there are no voids or concavities that can collect food or other. And once completed, delivered to the patient. And at this point, the prosthetic screws can be torqued to manufacturer specifications, checked for occlusion, and the patient can be dismissed. I want to provide special thanks to the 3 doctors who documented the videos on this tutorial, Dr. John Heimke, Dr. Ihor Danko, and Dr. Michael Morgan, all friends of Rowe Dental Laboratory. Thank you for watching and listening, and we encourage anyone to call the laboratory about any specific steps. And of course, if this is your first case of GuidedSMILE, We want to be chairside for the surgery. There is a fee for this, but it will be money well spent. Thank you.